Every year, millions of older adults go for their regular checkups, hoping to catch problems early and stay healthy. But what if I told you that some of these so-called routine tests could actually increase your risk of stroke overnight? It sounds unbelievable. You trust your doctor, you follow their advice, but hidden in the fine print of modern medicine are quiet risks that almost no one talks about. Not the news, not the clinic brochures, and sometimes not even your doctor. Imagine this. You walk out of your checkup with a clean bill of health. Everything looks fine. Then a few days later, you start feeling dizzy, your vision blurs, or your speech becomes slurred. You ask yourself, what happened? The truth is, certain diagnostic tests, especially when done too often or without considering your overall condition, can cause sudden changes in blood pressure and blood flow, sometimes triggering a chain reaction that leads to a stroke. Now, this isn't meant to scare you. It's meant to inform you. When you're over 60, protecting your health isn't just about finding problems early. It's also about avoiding unnecessary risks. Let's take a look at 5 common medical tests that may quietly raise the risk of stroke and what you can do to protect yourself before your next appointment. The first one is the CT scan with contrast dye. If you've ever had one, you probably remember that warm, flushed feeling spreading through your body right after the injection. That's the contrast dye doing its job, helping your doctor see your blood vessels and organs more clearly. It sounds harmless, even helpful. But here's what many seniors aren't told. That little injection can put temporary stress on your heart and blood vessels, especially if you already have high blood pressure, heart problems, or reduced kidney function. Some people experience a sudden drop in heart rate and blood pressure, leading to dizziness or even fainting. Others react the opposite way. Their blood pressure spikes, blood vessels tighten, and circulation becomes strained. That's when stroke risk quietly rises. A study in the Journal of Vascular and Interventional Radiology found that older adults with hypertension or heart disease who had contrast-enhanced CT scans were significantly more likely to experience vascular complications within 72 hours. One case involved an 81-year-old man who went in for a routine abdominal CT because of mild digestive discomfort. The scan looked fine, and he went home feeling normal. But 2 days later, he suffered a minor stroke. Doctors believe that a temporary rise in blood pressure caused by the contrast dye may have triggered a small clot to block blood flow to his brain. The takeaway? CT scans with contrast are valuable tools, but they should never be ordered just to check. Always ask, is this test essential? Can we do it without contrast? Sometimes an ultrasound or a non-contrast CT can give your doctor the answers they need without the added risk. The second test is the cardiac stress test. On paper, it sounds like a smart preventive measure. You walk or jog on a treadmill while your heart is monitored. But for people over 60, especially those with heart or blood pressure issues, this test can be riskier than it seems. As the treadmill speeds up, your heart rate and blood pressure shoot higher, putting your cardiovascular system under sudden strain. For a 30-year-old, that's fine. But for an older heart, it can be like lighting a match near dry grass. A 2020 study in the American Journal of Cardiology looked at more than 1,300 patients over age 65 who underwent treadmill stress tests. Nearly 7% experienced harmful events, including blood pressure spikes and abnormal heart rhythms. One woman, Margaret from Ohio, 74 years old, said her doctor suggested a stress test just to be safe. Halfway through the treadmill, she felt dizzy and short of breath. The next day, she had a mild stroke. Doctors believe that a sharp rise in blood pressure during the test caused a tiny vessel in her brain to rupture. The lesson: before saying yes to a stress test, ask your doctor, is there a safer way to check my heart? In many cases, a medication-based nuclear stress test or a resting echocardiogram can be safer alternatives. Next up, the endoscopy. Whether it's to check your stomach, esophagus, or colon, doctors often recommend these procedures just to be safe. And while they can be valuable when truly necessary, sedation adds another layer of risk, especially for older adults. Most people over 60 take daily medications like aspirin, warfarin, or Plavix, blood thinners that affect how your blood clots. Combine that with sedation, which naturally lowers blood pressure and alters circulation, and you could be looking at a recipe for trouble. A 2021 study in gastrointestinal endoscopy found that adults over 65 who underwent sedated endoscopies had a significantly higher rate of transient ischemic attacks, mini strokes, within 72 hours. These weren't full strokes, but they were warning signs that blood flow to the brain had been disrupted. One case involved a 76-year-old woman who had a routine colonoscopy with sedation. 2 days later, she began slurring her speech and lost her balance. Doctors concluded that the combination of sedation and daily aspirin use likely contributed to the event. That's why it's essential to ask, do I really need this procedure right now? Can it be done without sedation or with a lighter option? Always remind your doctor about every medication you take, even over-the-counter ones. The fourth test is the MRI with contrast dye, which uses gadolinium, a heavy metal that helps create clearer images. It's designed to leave your body through the kidneys, but here's the problem. After 60, kidney function naturally declines. If you already have mild kidney disease, even if it hasn't been diagnosed, your body may not eliminate the gadolinium effectively. Over time, small amounts can remain in your body, and that can cause problems. Gadolinium retention has been linked to a rare but serious condition called nephrogenic systemic fibrosis, which hardens the skin and connective tissues. Worse, trace amounts have also been found in brain tissue, and some researchers suspect it may cause confusion, dizziness, or balance problems in vulnerable seniors. In one study published in Radiology, 2019, about 5% of adults over 65 reported stroke-like symptoms, such as headaches, blurred vision, and balance issues within a week after an MRI with contrast. One man, Harold, a 79-year-old veteran, had such an experience. 2 days after his MRI, he felt weak and foggy-headed, later discovering he had stage 3 kidney disease that made it harder for his body to clear the contrast. The best safeguard? Ask, can we do this MRI without contrast? If not, request a simple kidney function test called a GFR beforehand. Finally, let's talk about the carotid artery ultrasound. It's non-invasive, painless, and often recommended to check your circulation. But for seniors with no symptoms, no dizziness, no weakness, no vision problems, this test can sometimes do more harm than good. Here's why. As we age, mild narrowing in the arteries that carry blood to the brain is common, but not every narrowing needs surgery. Unfortunately, some people are told they need a procedure like a carotid endarterectomy or stent, even when there's little proven benefit. A major study in the New England Journal of Medicine followed more than 3,000 seniors with moderate narrowing and found that surgery didn't reduce stroke risk any more than medication and lifestyle changes, but did carry higher immediate risks. Helen, 82, from Pennsylvania, learned that the hard way. Her scan showed 65% narrowing, so she went in for surgery. During the procedure, she suffered a mild stroke and now lives with partial weakness on her right side. I wish I'd known that doing nothing might have been safer, she said. So here's the bottom line. Not every medical test is bad, but not every test is necessary either. After 60, our bodies become more sensitive. A single injection, a bit of contrast dye, or a sedative can set off reactions we don't expect. That's why it's so important to pause, ask questions, and make sure every procedure fits your specific health needs, not just a routine checklist. You have every right to ask, is this essential? Is there a safer alternative? Informed decisions lead to better outcomes, fewer surprises, and greater peace of mind. Your health story matters. Your voice matters. The best medicine, sometimes, is simply knowing when to say, let's talk about this first.